Dr. Richard Kovacs, President of the American College of Cardiology.
Greetings, colleagues. As my state song says, I'm back home again in Indiana. As President of the American College of Cardiology, it is a privilege and an honor to kick off the first ever virtual annual scientific session of the American College of Cardiology, together with the World Congress of Cardiology. It's hard to believe that just weeks ago we were preparing for an unprecedented meeting in Chicago, where social interaction, not social distancing, was to be the norm. Where topics like telehealth, innovation, team-based care, and global accountability were sessions and not the new normal. I want to extend my personal thanks to each and every one of you who are on the front lines battling this unprecedented global pandemic. It has been inspiring to witness the sharing of ideas and knowledge from across the globe, from Asia, Europe, Africa, Australia, and South America to the United States, each with the goal of helping us to do what we do best, to help and heal. Cardiology is more than a profession. We are a family and a team. For the last 70 plus years of the American College of Cardiology, we have withstood wars, politics, acts of God, and acts of terrorism. We will withstand the latest challenge, the COVID-19. Why? Because we are a group of committed individuals united by a shared vision where a world where innovation and knowledge optimize cardiovascular care and outcomes. When I think of how to describe the ACC in 2020, in the year we have experienced, I think of many words of patience, teamwork, professionalism, diversity, inclusion, advocacy, collaboration, innovation, global health. Over the past year, we have delivered in each of these areas, whether it was launching the collaborative maintenance pathway option to the ABIM's Maintenance of Certification program, or welcoming MedAxiom into the ACC family as another vital component in our health system strategy. We have made headway on our long-term strategy to foster diversity and inclusion and ensure a seamless pipeline of new cardiovascular professionals and leaders. Look for these efforts to only strengthen and grow as part of our campaign for the future, which we will hear more about this fall. On the advocacy front, the ACC continued to deliver on its commitment to advancing health policy solutions that will move the needle in transforming cardiovascular care and improving heart health. We saw the largest contingent ever, more than 500 cardiovascular care professionals, go to Capitol Hill this past November for advocating for improving care delivery by reducing administrative burdens, by improving clinician well-being, and ensuring that health policies protect patient access to appropriate cardiovascular care. Now those same advocates are working hard to ensure that the COVID-19 pandemic does not threaten clinicians and practices whose lives and livelihoods are being upended by the abrupt change in how we deliver cardiovascular care. With COVID-19 clearly top of mind, I'm proud of how we have all rallied to share best practices and our perspectives and to advocate for increased telehealth measures and clinician safety. Whether it's joint webinars with our colleagues from Wuhan, China, practice guidance from MedAxiom and the ACC leaders, rapidly published research and perspectives in our JACC journals and the ACC.org COVID hub, grassroots actions urging lawmakers, regulators, and private insurers to provide additional flexibility around patient access and better access to personal protection equipment, and more available COVID testing. We are working together to address this pandemic in unbelievable ways. Similarly, last year had us accelerating our global activities with ACC international chapters and our cardiovascular society counterparts, especially the WHF, as well as our industry partners, NGOs, and others to address the very real impacts of non-communicable diseases around the world. Cardiovascular disease and pandemics clearly know no borders. The interpersonal and intersocietal relationships built by ACC members ACC staff around the world have made our responses more cohesive and better informed. We are stronger together. These friendships are more important than ever before to meet our goal of improving health equity and global heart health. This is just a small snapshot of the many successes and impressive progress made towards achieving the goals that are outlined in our strategic plan. But in truth, they pale in comparison with what we have accomplished and continue to accomplish as we navigate the constantly changing and uncertain environment in which we find ourselves now. Teamwork and collaboration are the name of the game in the COVID-19 battle. I've heard of teams adjusting shifts to address colleagues in quarantines or those facing family and personal logistical challenges due to school closures and job loss, or cross-specialty teams uniting to manage at-risk patients. Increasingly, I'm hearing of clinicians coming out of retirement to serve in any way they can. The best teams, whether in sports or in hospitals, are those that leverage the combined talents of all of their players. While there's no playbook for COVID-19, it is truly humbling to see teamwork and collaboration not only taking center stage, but succeeding. Professionalism abounds. It's inspiring to see our entire profession, individual clinicians, chapters, and societies alike, come together to share best practices and learn from each other. The insights from those on the ground in countries like China, Italy, Japan, Iran, and Korea are vital as COVID-19 continues to spread throughout the U.S. and other countries. Respect for each other and for diverse thoughts and perspectives is not only at the core of professionalism, it is also key to finding solutions that can save lives. I've often said that ACC's greatest strength is its ability to convene stakeholders, to help drive discourse and be a source of trusted information. A quick visit to the college's COVID-19 website on ACC.org is evidence. This is a great visual of convening in action, from joint statements with our partner cardiovascular societies to joint webinars and shared findings from our colleagues in China and beyond, the clinical guidance on telehealth, cath, EP, and echo lab recommendations, and other topics from our member sections and ACC chapters. We're facilitating the important conversations and making progress toward real solutions. The ACC.20 World Congress of Cardiology virtual experience is another incredible example of staff, leaders, and industry and our other stakeholders convening to bring the ACC.20 World Congress to life, just differently. In less than 3 weeks, these stakeholders, along with our incredible World Heart Federation partner, were able to pull together a meeting that is typically years in the making. Because of them, I am before you virtually. As the ACC.20 World Congress of Cardiology Chair Andrew Cates says, the show must go on, and it is. The challenges we face today are like nothing most of us have ever seen. To meet these challenges, we need to remain steadfast in our commitment to advancing knowledge, advocating for our patients and our profession, and being the trusted source for information related to cardiovascular care. The ACC needs your ongoing support, your wisdom, and your continued input. It is more important than ever to become engaged with your professional society and contribute whatever you can as a volunteer in not only this battle against COVID, the larger war against cardiovascular disease. 12 months ago, I stood in front of you on an actual stage and spoke about the importance of the ACC family. This family is more important than ever. I've spoken and written this year about my mother, Elizabeth Kovacs, who lived in good health to the age of 99. She was born in 1918, the year of the greatest pandemic the world has ever seen. Her infant brother died in the pandemic, and almost every family in the United States lost a family member. She not only survived, she thrived through a combination of intelligence, healthy lifestyle, and common sense. May we all heed examples like hers. It has been the greatest honor and privilege to serve as ACC with extended absences. My daughter Stephanie, who's an epidemiologist at the CDC, by the way, My son Jimmy and his wife Krista, and all of my colleagues at IU Cranner Institute of Cardiology and IU Health Cardiology. I especially want to note my administrative assistant Marlene Cox and my medical assistant Robin Tetrick for their help throughout the year. My family and my colleagues in Indiana had not only to deal with the rigors of an ACC presidential year, but a particularly challenging year. I am supremely confident that our next ACC president, Dr. Athena Pappas, will be an even better leader for the college. I also want to remember the long ago ACC CEO William Nelligan, and ACC past presidents John Ross Jr., Fred Beauvais, and Bill Winters, who all passed this year. Their legacies live on at Hart House and in all of us who had the privilege to learn from them and work with them. Dr. Winters lived by what he called the 4 rules of the road. Number 1, a good attitude. Number 2, be the best you can be. Number 3, have a learning experience every day and especially learn from your mistakes. And live your faith, whatever that may be. As we look to the immediate future, we have our work cut out for us. But I encourage all of us to take these 4 rules with us and practice them in our daily lives. In the meantime, stay safe, be well, and thank you. I can't think of any other group of people that I would rather be on the front lines with. Be safe.